knew at birth that he had a hearing loss. At birth it wasn't severe. They weren't even going to aid the right ear because it was very mild. They told us it was progressive and that it would become worse, but they kind of led us to believe it would be maybe 14, 15, 16 years before he would lose all of his hearing. So at about 18 months old, we started noticing the hearing aids not working. And I, with respect to the audiologist, tried to explain to her something's not right, he's not responding. It was about almost a year before I just had kind of said something is not right. So we did the test and he had lost all of his hearing, so he was now profoundly deaf. And I didn't know how to go about the right way in teaching him speech. I knew that he was getting an implant in the next few months and that he needed that speech. I didn't know quite how to do that. When I first heard about it, I didn't realize it was as different as it is. I thought it was a deaf school. So I was relieved in that way that there was some place for him to go and get kind of early intervention, because you don't normally go to school at 3 years old. So I was grateful for that. And I think when I first talked to Angie, I believe it was when I called her, talking with her for 5 or 10 minutes, a huge sigh of relief. I knew this was a program that we had been looking for and that we wanted. I got off the phone, I called my husband who's in dental school, and he was with a patient, and I made him, get away from his patient and come answer the phone. And I was in tears, and he thought something was wrong, and I was so excited that we had found this place, and I knew that we were going to be safe here and Logan would be taken care of, and that we'd be directed in the right direction. The progression that he has made being here has been leaps and bounds. I think one of the most important thing I've learned is that children learn speech best in a normal atmosphere. I've been really worried as a mother, once we move, to not have this kind of support, to have the parent support group, to have the parent classes, to have him in an atmosphere where he feels comfortable and he's like other kids. So they, again, have been great in teaching me all I think I need to know. Something like this clinic, there's not very many of them across the country as far as an oral deaf education. And I told him that I'm from Las Vegas, and we thought maybe to go back there, and they have nothing like this, even close to this. And the best thing, it's free. I mean, how great is that? How unique it is too that it's a parent-based program. You never find that, even with normal school programs. And what a concept that is, because I think as a parent, most people think that you send your kid to school, they learn everything they need to learn, and they come home and you go about your day. But how important it is to say, no, I'm the one that they're going to learn from, and I'm the one that can continue this on.
What is it? It's a teacher. Good. Teacher. Tell Jenny. Teacher. You want the teacher?
Pull it out. I think when you first hear of hearing loss, you think, well, he won't be able to speak. He may have to do sign language the rest of his life, which isn't going to help him to be mainstream. And I thought a lot of hopes and dreams you have for your child go away, I think. Speech is an important part of life and of being successful in life. And so we were really distraught about that, thinking that he would have to be in a special school the rest of his life. And we thought maybe by high school, we could get him to be mainstream with an interpreter, and going from there to coming here to John Tracy. And that's a lot of what they're about, is hope. And during a parent class one night, they had children that have gone through a John Tracy program come and visit us as parents and speak to us. I think my husband and I both went home that night and just cheered for joy, seeing it is possible, it's going to happen. But these kids that we met at parent night, you would never know, had you not seen their equipment, that they were deaf or hard of hearing. So that gives us a lot of hope. And again, we attribute that to here, because we would never have known that there are possibilities out there for him. And I don't know that he would be where he is right now had I not had that direction. I wouldn't know how to do it. I look at him now and the progress that he's made. We're thinking, by first grade, he could be mainstream. And to me, that's, fantastic. So.